So let me share my screen and then let's get it up. Okay. So in the last session, we have started the CPTs and covered the modifier portion also. So from today onwards, we will start the chapter and how to find the code in the CPT. So this is in CPT manual. I hope you already had the CPT manual in your systems or in your phone, which I have already shared the last week itself. So as we are going to start the CPT and we will discuss about the anesthesia portion. So first we will learn how to find the code in the CPT manual. To find the code, you have to refer the index. In the CPT, your index is listed at the end of the all appendix and every codes. So first we reach to the end of the code. So you can see here. This is end of the all the appendix. This is the last appendix we have in our manual. After the appendix, we have the index. In the index, we have to look for the procedure which we are looking for, where we are trying to find the code. We have to refer that word in the manual for that procedure. So let's say we are going to learn about the anesthesia. So to find the code for anesthesia, we have to refer anesthesia in our manual. Here we go. Here we have the anesthesia. You can see our anesthesia codes are listed from series 0. So our all anesthesia codes are begins from character 0. And remember, in the CPT, all codes are 5 characters numerical codes. And in the ICD, we have the alphanumeric code. So in CPT, you will get codes, the numerical codes only, and all codes are 5 characters. So for anesthesia, our codes are of 5 characters. So now I'm going to pull the code in the manual. So again, to find out the code, you have to refer the end of the manual to find out the index, because all codes are listed in the index itself. And to further verify your code, you have to refer the code in your CPT volume 1. Pull the code. So 00102. Let's pull the 100 page number to find out the code. So 0 codes are listed after the 9 series. So our anesthesia chapter begins from here. So before proceeding with the anesthesia guidelines, let's learn about the anesthesia a little bit. Then we will move to the anesthesia guidelines. So let me pull the guidelines here. Just allow me a moment. So let's get started. So anesthesia, we have to provide the anesthesia for the major surgery, and we have approx 4 types of anesthesia. general anesthesia, regional anesthesia, local anesthesia, and the topical anesthesia. So we have majorly four type of anesthesia, and we have to proceed with the anesthesia before the procedure. What anesthesia will do? Anesthesia control the loss of feeling. So anesthesia anesthetize the patient so that he or she does not feel the pain during the procedure or during any medical procedure. So type of anesthesia defines the anesthetized region. Like we have the local anesthesia, which numbs a small area, a little bit area, the local area only. Then we have the regional anesthesia, which anesthetize a particular limb or particular region itself. Then we have a general anesthesia. General anesthesia will anesthetize the complete body, complete loss of awareness. And in the local, then we have the epidural anesthesia and the spinal anesthesia. The epidural anesthesia and the spinal anesthesia are the part of the regional anesthesia itself. So the spinal anesthesia, patient will get the anesthesia in the spinal fluid or under the in the spinal subarachnoid space, and epidural anesthesia, anesthetic agent injected in the epidural space. Then we have a nerve block also. So for the codes for nerve block are not listed in the anesthesia chapter, that is listed in the 6 series, because that series is related to the nervous system. And then we have another type, that is MAC, which is monitored anesthesia care. So before proceeding with the codes, let's go through with the few anesthesia modifiers. We have these anesthesia modifiers which needs to be used with the anesthesia codes in all the situation. Anesthesia modifier will represent what provider is doing, what is the condition of the patient at the time of the anesthesia. Whether the patient is normal, healthy patient, or whether the patient have any mild systemic disease. So what is the situation of the patient at the time of anesthesia? We are going to represent with the P modifiers. So that is all these P modifiers are also known as the physical status modifier. It will represent, these are the physical status modifiers. These physical status will represent how the patient is doing at the time of the procedure. You have to use the P1 modifier when the patient is completely healthy. Healthy means patient is non-smoker. If the patient is non-smoker, you are going to use the P1, or minimal or no use of alcohol. Minimal or no use of alcohol. That also comes under the healthy patient. Then we have patient with the mild systemic disease. Systemic disease are those diseases which affect the whole body. So let's say patient having a obesity or well controlled diabetes. These comes under the mild systemic disease. So I'm going to mention a few example here. So mild well controlled diabetes, when controlled diabetes or hypertension, when any lung disease, because lung disease is also known as systemic disease. Then we have the severe systemic disease, patient with the severe systemic disease. So the examples for the severe systemic disease will be poorly controlled diabetes, because diabetes is a systemic disease. Poorly controlled DM, or even the hypertension also, because these two are the systemic disease. And COPD. COPD is also known as the systemic disease because it is going to affect the whole body. Obesity, So if any patient having these type of conditions, we are going to consider them under the severe systemic disease. So whenever patient is having a substantive functional limitations due to the severe diseases, if there is any functional limitation due to that diseases, we are going to consider that diseases in the severe systemic diseases. Next we have P4. We have to consider P4, patient with a severe systemic disease with a constant threat to life. Constant threat to life. Examples are like patient have the myocardial infarction. So if the patient have the myocardial infarction, then we are going to consider it as a systemic disease. Severe systemic disease that there is a threat to life. So I'm going to mention it here. Myocardial infarction or cerebrovascular accident is also known as a severe with a threat to life. TIA also. And let's say ongoing cardiac ischemia, valve dysfunctions, reduction of the ejection fraction, which will lead to the heart failure, sepsis, any acute respiratory distress, any end stage renal disease. And if the patient have the any end stage renal disease and patient not going into the dialysis or the scheduled dialysis, then we are going to consider this as an severe systemic disease that is constant threat to life. And at the end, we have the 5 modifier. Any patient who is not expected to survive without the operations. So we have to treat that patient emergently. If we are not going to treat that patient right now, then there is a high risk of the survival, very less chances of the survival. So examples are massive trauma. Let's say patient had a very massive trauma, any massive accident, intracranial bleed, and any multiple organ dysfunction, MOD. So these are the conditions where the provider we have to treat the patient emergently. We cannot delay the treatment of the patient. Next, we have a declared brain dead patient where we have to give the anesthesia so that we can remove the organs from the patient's body. Any questions in the modifiers? Any doubt? Okay, I'm considering that he does not have any doubt. So what I'm going to do, oh, I received one message. Perfect. Now I'm going to mention a particular disease here. You have to tell me what P modifier we have to append for that condition. So let's say patient is current smoker. Patient is current smoker. What will be a P modifier for that? Tell me if the patient is current smoker, then what will be the modifier? I receive only one answer. Any other answers? Anyone aligned with P3 modifier, or everyone is with P2? Very good. Someone told me P4. We cannot proceed with the P4 when the patient is just a smoker. Current smoker does not represent any condition which is threat to life. So P4 will not going to use for the current smoker. Let's do the another example. Let's say patient have the mm, okay, active hepatitis. Let's say patient have the active hepatitis. What will be the modifier? P3 or P4? For active hepatitis, tell me the modifier. What will be the modifier for that? Right. Active hepatitis P3. So everyone responded with the P3. One last example we are going to do now. So let's say patient is this one. Let's say patient is alcohol dependent. Patient is alcohol dependent. What will be the modifier? Alcohol dependent. P3 or P4? So for alcohol dependent also, we have to proceed with the P3 because with the dependence, there is no constant threat of life because it's not something which needs to be treated at right now. That will also come under the P3 modifier. So I'm hoping that these modifiers are clear to everyone. Now, in conjunction with these modifier, with the physical status modifier, we have to use few other modifiers for the anesthesia services. Those modifiers will represent service is performed by whom. So we have a modifier, let me mention it here. We have a modifier AA. We have to append the modifier AA when the service is given by the anesthesiologist. When the anesthesia is given by the anesthesiologist, we are going to use the modifier AA. Anesthesiologist. So when the service is given by the anesthesiologist, we are going to use the AA modifier. Then we have QK modifier. We have to use the modify QK when the medical direction, it's in medical direction of 2, 3 or 4 co-current anesthesia. Co-current, let me mention it clearly so that you can review. Co-current procedure by a physician. We have to use this modifier when the medical direction of 2, 3 or 4 co-current anesthesia procedures are given by the physician. Then we have QY modifier. QY modifier will represent that medical direction has been given to the CRNA or the anesthesiologist assistant. Then QX will represent that anesthesia was given by the CRNA. So I'm going to send you the one picture which will tell all the modifiers. Just give me a second. I have sent you the picture of the modifiers. So remember, we have to use AA modifier when the anesthesia is given by the anesthesiologist. We have to use QZ modifier when the anesthesia is given by the CRNA. CRNA stands for Certified Registered Nurse Anesthesiologist. We have to use QS modifier to whenever there is a monitored anesthesia care has been given to the patient. Then QX modifier that will represent that anesthesiologist is directing the CRNA. QY anesthesiologist directing CRNA only one patient case. If it is more than one, we are going to use QK. And then we have the AD modifier, that medical supervision by the qualified individual to the 2 patients. So these modifiers we have to remember. It will help us to code the anesthesia cases easily. Now, let's proceed further. Now we are going to discuss about the qualifying circumstances. So after the modifiers, we have the qualifying circumstances. Qualifying circumstances will represent, basically qualifying circumstances are the add-on code. Let me show you here. So these are the add-on codes. How we have identified that these are the add-on codes? Because at the beginning of all codes, we have the icon plus icon. So at the beginning of all codes, we have the plus icon. Guys, you guys are able to unmute yourself? Did you have that authority to unmute yourselves?
Yes, ma'am.
Perfect, perfect. I just wanted to check on because I want you will ask the questions if you want. Okay. So if you are unable to understand any of the letter or any of thing, please let me know so that we can rediscuss that. Okay. So now let's start with the qualifying circumstances. These four codes are known as the qualifying circumstances. These are the add-on code. Add-on code means we can use these code at the second position only. At the second position only. So we have to use these codes at the second position only. Then as we have to use these code at the second position only, so here we have the list of the primary codes. Like what will be our primary codes, and we can use these codes with this parenthetical instruction. So like you can see here, we have to use 99110 for all the anesthesia code in conjunction with all the anesthesia code. However, we cannot use these codes with these series. So these qualifying circumstances are the unusual circumstances which can happen during the procedures. So in that case, we have to use unusual circumstance. So our first code is 99100. We have to use 9911 99100. Anesthesia has been given to the patient where age is the 9100. So you just need to remember, if the code descriptor already includes the age of the patient, then there is no need to represent the age separately with code 99100. Let's take another example. Let's see 00561. So this is the another example. Now tell me, with the code 00561, are we allowed to use 99100? Is there any need to use 9 99100? Do we have Are we allowed to code 00561 as well as 99100 together?
No, ma'am.
Very good. We should not. Why? Because age is already a component of the code. So we are not going to use this. Now let's proceed with the other modifier. Now our next qualifying circumstances 99116. Let me go 99116. We have to use 99116 when the anesthesia is complicated by the utilization of total body hypothermia. So, total body hypothermia means when during the anesthesia we have to reduce the temperature of the patient, then we have to use this code. So, your medical documentation should state the reason that why there is a need of hypothermia or hypotension. And any condition where there should be a condition which will represent why there is an anesthesia on the low body temperature on any hypothermic patient. Now, next code is 99135. We have to use 99135 when the anesthesia is complicated by utilization of controlled hypotension. So, when there is an intentional hypotension due to the procedural requirement, then we are going to use 99135. And in the last, we have 99140. So, when 40 we have to append when the anesthesia is complicated by the emergency condition. So, when we have to do the procedure, in that case, in the emergency situation, emergency is defined as an condition. If we get the delay in the treatment, then there is a significant increase in the threat of the patient's life or the body part. So that is defined as an emergency. So if there is an emergency and we need to treat the patient ASAP, so in that case we have to use 99140 in conjunction with the anesthesia CPT. So in your examination you will find 99100 as in common code or as in question, but other than that you will not find any code from the qualifying circumstances in your examination. Let's move further. In the anesthesia, we just have the one instruction here, time reporting instruction. So time reporting means we have to report the anesthesia time also. So anesthesia time, it starts from when the anesthesiologist enters the room. So once anesthesiologist enters the room, the time has been started, and when he comes out of the room, time ends. So anesthesia time is corely based on the anesthesiologist presence. So if he present in the room, we are going to use the time for the anesthesia. So anesthesia time is not dependent on the surgery time. There is a chances that surgery took less time, but we have to give the anesthesia for the extra time. So we are going to bill for the anesthesia only. So there are the chances where we have to bill for the anesthesia and anesthesia time, and the anesthesia time is not based on the time of the surgery. I'm going to send one question to you. We will proceed with that question first, then we will move further. I will send that question in your WhatsApp chat, okay?
Hello, ma'am.
Yes.
Ma'am, this time reporting will be different from the actual time of patient being under anesthesia.
Yes. The anesthesia time is different than the anesthesia time as well as the different than the surgery time. So anesthesia time is totally based on the anesthesiologist. When the anesthesiologist enters into the room, anesthesia time starts, and when he left the room, anesthesia time's over. Okay.
Okay, ma'am. Yes, ma'am.
So I have just sent the question. Try to attempt that question. I request that all of. Okay. Now let's discuss this question together. Now, based on the question, patient is a healthy patient having a needle thyroid biopsy. Anesthesiologist started the visits at 9 a.m. I'm sorry. And the surgery begins at 9:15, ends at 9:45. Anesthesiologist turn over the patient care to the recovery room in 10 a.m. So the anesthesiologist spends 9 a.m. to 10 a.m. It should be the 1 hour. So we have to rule out the option number B and option number C because those two options consist 45 minutes. So neither the B answer, neither C. The answer should be between A and D. And to verify the correct answer, we have to refer the code 0320 and 0322. Now let's read the description of 320. So 0320 will tell anesthesia for all procedure on esophagus, thyroid, larynx, trachea, and lymphatic system. And 322 is need to be used for linear biopsy of thyroid. So our correct code or the correct answer for this question should be D. Why D? Because we have to consider anesthesia time when that anesthesiologist starts preparing the patient. And the anesthesia time ends when the patient is when the anesthesiologist left the patient in the recovery room. Does that make sense? Any questions? Why the answer is D on this one? Any doubt?
Ma'am, can you repeat once?
Yes. As I told you that anesthesia time starts when the anesthesiologist starts preparing the patient. And the anesthesia time ends when the anesthesiologist left the anesthesia room. So, in our question, anesthesiologists start preparing the patient at 9 a.m. and the anesthesiologist left the room at 10 a.m. So, the time should be 1 hour. It should be 1 hour. So, the anesthesia time we are going to bill is 1 hour instead of the 45 minutes. So, if we consider 1 hour, then our code B, option number B and C has been ruled out because in the option B and C we have the 45 minutes mentioned. So answer should be between the option A and D. And to verify the correct answer, we have to refer the CPT code. So if we read the description of CPT 0320 and 0322, as in the process in our question, natal biopsy of thyroid has been performed, so it should be 0322. Clear?
Yes, ma'am.
I'm going to send one more question because none of you responded correctly on the previous one. I'm going to pull
I
the
gave
question.
correct answer, ma'am.
Yes, D is the correct one. Okay. So the code description I have pulled in our screen. So the codes are 0566 and 0567. Go through with the code and tell me what will be the correct answer for the question. You have to respond on the WhatsApp chat only because I'm unable to understand. Okay, nice. Perfect. I can see so many of you are already answered. So now let's discuss this question. I- Okay. So as per the question, patient having a multivessel coronary artery disease, procedure is CABG, and patient is placed on the heart and lung bypass machine during the procedure. Anesthesia time 6 p.m. to 12 a.m. and the surgery starts from 6:15 till 11:30. So 6 p.m. to 12 a.m. that means 4 hours. Oh, sorry, 6 hours. So our answer C and D has been ruled out. We have to pick a option from option A and D, A and B. And the difference between A and B is pump oxygenator. So in our documentation, it was mentioned that patient has been placed on heart and lung machine. So that heart and lung bypass machine is known as pump oxygenator because it will work as an artificial heart and lung during the procedure. So this is known as a pump oxygenator. So our correct code should be 00567 instead of the 00566 because 566 is without pump oxygenator. So whenever you see this term, pump oxygenator term, pump oxygenator is an heart and lung machine. Let me show you here. So if we pull heart and lung bypass machine, so this is an cardiopulmonary bypass, or that is also known as pump oxygenator, pump and or CPP pump. So this has been used for the open heart surgery so that we can maintain the circulation of the oxygen in the blood. So the correct answer should be A. You guys are clear that why we are going to use the option A? Guys, clear? Shall we proceed further? Any
Yes,
doubt in
ma'am.
this? Okay. I was waiting whether you have any questions or not. Okay, so now anesthesia time is clear to you, anesthesia modifiers are clear, qualifying circumstances are clear. Now proceed with the codes. So our anesthesia codes are varied from top to bottom. So at the beginning, we will get all the codes for the head and then neck, then humerus, and then so on. So all our code are listed top to bottom, anatomically top to bottom. So like you can see in your screen, first we have the codes for the procedure performed on the head area. The first code is 00100, that is for anesthesia for the salivary glands. So any procedure is performing on salivary gland, including the biopsy or any other procedure. In that case, we are going to use the 00100. We have to use 00102, that is for the procedure involving repair of cleft lip. So if the patient is coming to get the repair of the cleft lip, we are going to use 00102. We have to use 00103 for reconstructive procedures on the eyelid, such as blepharoplasty or the pertussis repair. Then we have 00104 for the electroconvulsive therapy, ECT. Then 00120 for the ear, middle, inner, and external ear, and 124 when it is for otoscopy. Now I have to tell you the one difference between the parent code and child code. You can see here, we have three codes here. We have three codes here, 00140, 00142, 144, and 145. In these codes, we have the parent and child code relationship. How we can identify that? You can see here. In the 00140, we have this semicolon. Whenever you have a semicolon in your code, it will represent that this is a parent code. Whenever you have the semicolon, this will tell you that this is a parent code. And under that parent code, you will find the child codes. In the child code, the difference between in the parent and child code is just in the parent code, we have a complete description. But in the child code, we have a partial description. Partial description means the extra word that is only listed in the okay. Let's go further. So the complete description for the 00124 will be anesthesia for procedure on external, middle, and inner ear, including biopsy and otoscopy. Same like here, the complete description for 00142 will be anesthesia for procedure on eye, and then we are going to add the lens surgery. So how we are going to read about it? The description of the parent code, description of parent code plus till the semicolon. You have to remember that you have to add the description till the semicolon plus the description of the child code. So again, the description of the parent code plus the description of the child code will tell you the complete description of the child code. In the child code, we does not have the complete description. For the child code, we have the partial description. So like why we have this is why we have this in structure, because if we will going to have the complete एक second. So why we does not have the complete descriptions in the child code? Because if we are going to add the complete description in the all codes, our book size will reduce to the double. Sorry, increase to the double. So to reduce the size or to reduce the number of the words, the description of the child code has been reduced and instruction has been given to us as an coder, and the instructions which tell us that whenever we are going to read the child code, the description of the child code, we have to add the description of the parent code till the semicolon plus description of the child code. Does that make sense? Are you guys clear on this, that how to read the description of the child code? You guys
Can
are
you
clear
tell,
that how to?
can you tell again, ma'am?
Okay, I'm going to repeat it one more time. So the difference between parent and child code, that in parent code you will get the semicolon and you will get all the details. But in the child code, you can see here the alignment is little bit different. All code description starts from here, but the for child code description starts from here. So to read the description of the child code, first we have to add the description of the parent code. Then we have to add the description of the child code. Clear? So the complete description, if we talk about the 00148, the complete description will be the description till the semicolon of the parent, anesthesia for procedure on eye, and then we have to add the description of the 00148. So it will be anesthesia for procedure on eye, ophthalmoscopy. This will be our description. Clear?
So, ma'am, what you are telling is 00140 is parent code, and starting from 00142 to 00148 is child code. Is that what
Yes.
you're trying to explain?
Yes, yes.
Okay, understood.
Okay. Now, can any of you tell me the complete description of 00145? Tell me the description of the 0014. I've asked. Tell me the description of just what will be the description of 00145. Unmute yourself.
Uh, 00140.
Yes, what will be the description when we have to use the 00145? We have to use an 00145 and the anesthesia is given on eye for the vitreoretinal surgery. Then we have to use the 00145. Clear? Clear to everyone?
Yes, ma'am.
Yes.
Okay. Let me give you one question to understand whether you guys are able to read the description of the code or not. Okay. So we will proceed with one question. Okay. Now let's discuss this question together. So our question is 56-year-old patient receives the general anesthesia for the open pleura biopsy. An anesthetologist medically directs two other cases and two CRNA on these cases. What are the anesthesia? What codes or modifiers we have to open? So we have a two code set series 00541 and 00540. So the difference between these two is the utilizing one lung ventilation. In our documentation, we does not have any documentation which will tell us that there is a one lung ventilation. This is a machine which has been used. So it does not have that documentation. So I'm going to cross it out. So our answer should be between A and B. C and D has been ruled out. So the difference between A and B is the modifier AA. We have to use the modifier AA when the anesthesia was given by the anesthetologist. In our case, anesthesia is not given by the anesthetologist. It is given by the CRNA and it has been under the direction, under the medically directions. So we have to use QX modifier and QK modifier to represent that there is a direction given by the anesthetologist and the anesthesia is not given by the anesthetologist. So whosoever selected option A, I think Jamil did that, Hansini did that. So can you tell me even the Vaishnavi and the, no, Vaishnavi also. Can you tell me what is your reference for using the AA modifier? AA modifier need to be used only when the anesthesia is given by the anesthetologist. Then only we are going to use that. Okay.
Yes, ma'am.
Okay, ma'am.
Let's move further. Now you guys are able to read the description of the code and able to identify the difference between the parent and child code also. So let's go through with the codes one by one. Let's cover this question chapter solve. So we have started with the head. We have covered till the eye procedures. Now 00160, anesthesia for procedure on the nose and accessory sinuses. When it's in radical surgery means with the procedure on the location, doctor is also removing the adjacent lymph nodes. If the doctor is also removing the lymph nodes, adjacent lymph nodes, we are going to state that surgery as in radical surgery. So in the further chapters, you will see radical surgery term so many times. We have to use radical surgery term whenever in conjunction with the organ, if adjacent lymph nodes and adjacent tissues has been removed, in that case, we are going to use the word radical surgery. Then we have biopsy. So that is biopsy is on the nose and the soft tissue. Then we have a procedure for the oral procedures. It's biopsy, cleft palate, excision of tumor, and the radical surgery. Okay. Can any of you tell me the difference between 00176? So the difference between 00176 and 00162. Any of you can tell me the difference between these two?
Ma'am, 00160 is anesthesia for procedures on nose, and the other one, 00176, is anesthesia for intraoral procedures. Like those two are for different positions of nose, I guess.
Yes, you correct. These two are for the different locations. So that's the only reason we need to go through with the description of the parent code to identify the correct location of the procedure. Next, we have the anesthesia for the procedures on the facial bones. This one facial bone and this one the radical surgery. So radical surgery means that the adjacent tissue as well as the adjacent lymph nodes has been removed. Then we have 00210 anesthesia for intracranial procedures. Intracranial procedures means procedures on brain. Then we have to use 00192. Then we have 00210 anesthesia for intracranial procedures. Intracranial procedures, I've already told you, any procedures on brain. Then we have craniotomy, cranectomy, removal of craniums. Otomy means incision, doing incision in the cranium. Ectomy means removal of the cranium. So whenever there is a removal of the cranium for the evacuation of hematoma, and the procedure is craniectomy and the doctor is given the anesthesia for this one, we are going to use 00211. For subdural tap, we are going to use 00212. For burr holes, 214, 215. For vascular procedure, 216, and so on. Then we have neck. For neck, our code includes the descriptions, includes the age of the procedure also. Age of the patient, sorry, not the procedure, age of the patients also. Okay. Then anesthesia for all procedure, first code is 00300. Anesthesia for all procedure on the integumentary system. Muscles, nerve and head and neck, posterior trunk. This is for integumentary system, muscles, nerve and this. So any procedures, nerve on of head, neck and the posterior trunk. Then we have 00320. 00320 will represent anesthesia for all procedure on esophagus, thyroid, larynx, trachea and lymphatic system when the patient age is 1 year or older. For the same situation, I'm going to send you the one question. We will do that question first, then we will proceed further, okay? Let's see who all responded. So received from the Misika, Jamil, Vaishnavi, and one more. Okay. So everyone answered with the option C. So let's go through with the question then. So our question is, general anesthesia for 9-month-old and patient is undergoing the tracheostomy. We have the two options 320 and 326. 320 is a trachea and the 326 is anesthesia for all procedures on the larynx and the trachea. This one is when the age is 1 year or older, and this one when the patient age is younger than 1 year of age. So 1 year of age, if the patient is younger than 1 year of age, we are going to use 00326. And as in the parenthetical instruction, we have an instruction that we are not going to use the 99100 in conjunction with this. So the answer should be C. So our answer should be C only. Now let's move further. Our next procedure is on the thorax. So anesthesia for procedure on the integumentary system of the extremities, interior trunk, and the perineum. The above one, the next series will come for the posterior trunk. If anything performed on the posterior trunk, you have to use the neck section. And if anything is performed on the anterior trunk, we are going to use a code from the next we have 00402. Reconstructive procedures on the breast. Then we have 00404 radical and modified radical procedures on the breast, and this one is with internal mammary node dissection. So even though it has been a radical procedure, lymph node has been dissected. Still, if the internal mammary node dissection is also has been dissected, then we are going to use 00406. Later on, we have 00410, electric conversion of the arrhythmia, that is also on the thorax and the chest cradle. 450, anesthesia for procedure on clavicle and scapula. Then we have biopsy of clavicle. Anesthesia for partial rib section, not otherwise specified. Then we have thoracoplasty. And then radical procedure, that means with the rib pectus excavator muscle has been removed in conjunction with the procedure. And let's move further. Intrathoracic. So the intrathoracic, we have the anesthesia procedures on the esophagus, any procedures on the chest, any procedures on the pleura, that we are going to consider this from the intrathoracic section only. So first we have 00500. Anesthesia for all procedures on the esophagus. 00520 for the anesthesia on the chest procedure or closed chest procedure. Closed chest procedure means that incision has not been placed in the chest, but just in normal closed procedures has been completed. Normal closed procedure means thoracoscopy, bronchoscopy. These are when the scopy procedures has been performed, we are going to consider this as an closed procedure. Open procedures are where the chest has been incised, then we are going to consider that as an open procedure. Next we have 520, 522, 524, and the 8. This one is on chest, but needle biopsy. This is pneumocentesis. Then we have mediastinoscopy. anesthesia for permanent transvenous pacemaker insertion, and to access the central venous system. So these are the normal procedure. You have to just remember one thing. You always need to follow these parenthetical notes. Parenthetical notes are too important to identify the correct codes and to verify the complete, guideline, coding guideline. So you can see here with quite 3-4 is for the transvenous, that means through vein. And this is the pacing of the cardiovertebral defibrillator. And if the same procedure is done with the transthoracic approach, you are going to use the code 00560. So you can see here, this is the anesthesia for procedure on heart, pericardial sac, and the great vessels. We are going to use this procedure code when the procedure has been done performed with the transthoracic approach. Okay, let's move further. On CPT 00161, we have an instruction that we cannot use 0016561 in conjunction with the 99116 and 99135 also. So 00561 cannot be used with the hypothermic as well as hypotension code. The qualifying circumstances which we have studied earlier. We cannot use this code with those two codes. Next, we have a code 00562. When the procedure is performed on with the pump oxygenator and the patient is 1 year or older, and all non-coronary bypass procedures. If it is in coronary bypass, we have to use a different code. If it is a non-coronary bypass procedure, such as valve procedures, in that case, we have to use 00562. Let's proceed further. Then we have 00563 with the pump oxygenator with the hypothermic circulatory arrest. So if during the procedure hypothermia has been obtained to completely do the procedure, in that case we are going to use 00566. Sorry, 563. That's the only reason we cannot use 99166 in conjunction with these series, because we have a separate code for the hypothermia. Then we have spine and spinal cord procedures. So the first procedure is on spine, cervical spine and cord. And here we have the instruction that if there is a percutaneous image guided spine and spinal cord anesthesia, we have to use 1937 series. If it is an percutaneous image guided spine and spinal cord anesthesia procedure. If it is a normal anesthesia, we have to use this one. If it is an image guided means under a image, under the fluoroscopic image, under the X-ray image. Then we have 00604 procedure with the patient in a sitting position. So we are doing the spine anesthesia, provider is doing the spine anesthesia, but patient is in the sitting position. Then we are going to use this code. Then we have 00604, procedure with the anesthesia procedure on thoracic spine and cord, not otherwise specified. So the difference between the above one and here one, this one is for the thoracic, the previous one with the cervical. And then this one is for the anterior transthoracic approach. So this code after the transthoracic approach. Then 6 to 6, one lung ventilation. And if the anesthesia has been given for the thoracotomy procedure, we have to follow 5 series, 00541 series. Next we have I'm going to skip few procedures because these procedures are word to word. So I'm going to skip few. Next we have upper abdominal area. So the anesthesia procedure on the interior abdominal wall. As its name says, that is on upper anterior abdominal. Then we are going to use this one. If it is on percutaneous liver biopsy, then we are going to use 00720. And if it is on upper posterior abdominal wall, we are going to use 00730. We have a one word here, you can see paniculectomy. Paniculectomy is a surgical procedure on the lower anterior abdominal wall. We have to use paniculectomy word. We have paniculectomy surgery represents that removal of excess fat and the excess skin from the lower abdominal. That is also known as belly fat. So that removal of belly fat is known as paniculectomy. So in your documentation, you will not get the word of paniculectomy directly. You will get the word that removal of the excessive fat. So in that case, it is your responsibility to consider that as in paniculectomy. Then we have a very straightforward score. We can do one question now to make sure that we are going to understand the procedure descriptions and align the procedure correctly. And after this question, we will proceed further. Together now. So everyone answered A. Okay, I got the new answer B. Let's review this question together. A patient having a large lipoma, which has been removed from the chest, which measuring approx 8 square centimeter and the defect is 12.2. For that, we have to do the layered closure with the extensive undermining and we did the MAC. So whenever you see MAC in your documentation, you have to append the QS modifier. So we have QS modifier in all the codes. Performed by the medically directed CRNA. So we have to see now whether QXA is applicable or not. So QXA is a service when given by the CRNA under the medical directive. So we have to use QX also. Okay. So now back to the question. For the anesthesia services, we have two options, 400 and 300. Let's see the difference between these two. So the 400 is on the anterior trunk. Lipoma has been removed from the chest. It was just chest and only. So it is an anterior chest, not the posterior one. We have to use 300 when it is an posterior. That means that's not the chest, that's the thoracic area. So definitely we have to use option 400. So the answer should be A only. So Mashita, you were correct. So the answer is A. Very good, guys. This is the correct answer. Now let's wrap up the session quickly. Now let's go through with the in-depth procedures. Next we already covered the lower abdominal area. Then we have perineum, anesthesia for anorectal procedure, radical perineal procedure, vulvectomy, vulva has been removal. Whenever you see ectomy word at the end of the procedure, that means ectomy means removal. Then we have transurethral resection of bladder, then prostate, then we have lymphadenectomy here. Lymphadenectomy means lymph nodes has been removed completely. So we have same kind of procedures in all the sections. So I'm seeing you can see here tenotomy. Otomy means that incision has been performed in the tendons. Tenoplasty means repair has been performed. Then we have tenodesis, that means fusion of tendon has been performed. We have these are the tendon procedures only. Now you can see there is one more series that comes under the radiological procedure. When the anesthesia is given under the imaging, under the fluoroscopic guidance or under the any imaging, in that case, we are going to use a code from series 019. That's it. We have another section or the separate section for the OB procedures. When the anesthesia has been given for the OB procedures. And the last code, we have the unlisted code here. We have to use unlisted code whenever documentation does not include the complete detail of the procedure. Sorry, documentation includes the complete detail of the procedure. However, we does not have a specific code in our documentation. In that case, we are going to use 00199. So we have to use 01999 whenever there is an procedure mentioned in the documentation, but we does not have the code. Then we are going to use the unlisted code. Any questions so far?
No, ma'am.
Okay. Just allow me a moment. I'm going to send you the.
For you,
Uh-huh. Yes,
I
go
have
ahead.
few questions from CPT, ma'am.
Yes, tell me what are your questions?
No, I'm telling, can you give us few questions like from CPT we can solve so that we can do
Okay,
some
okay.
practice.
Yes, I'm going to do that. I have shared one assignment for the anesthesia. So try to solve those questions. I'm going to send one more assignment with you for the modifiers also. In the last session, modifiers has been completed, right? So I'm going to send that too so that you can do the practice for modifiers too. Okay. Anything else?
Thank you, ma'am.
Thanks everyone. Thanks for your time. Bye bye. We'll meet next time on the next weekend.